with the Rocket Right Show. I'm Dr. Kay Solar in the house with Hurricane Betsy Barnes. And our medical segment is brought to you each week by Mary Bird Perkins, Our Lady of the Lake Cancer Center. And so glad that my husband could join me, Dr. Curtis Solar, OBGYN at Louisiana Women's Healthcare Associates. Thank you on this.
Glad to be here.
February is Heart Disease Awareness Month.
Yes, it is.
Yeah.
Women's particularly.
Women's particularly. And so...
Wear red.
Wear red on Friday. Wear red. I know we're Mardi Gras it tonight, but on Friday, we're going to be wearing red because it's National Wear Red Day.
That's right.
So, but, you know, I think a lot of people know that heart disease is the #1 killer of men, but a lot of people don't think that it's the #1 killer of women, too, which it is.
Easily forgotten.
I know. And I think most women are surprised to hear that.
Yeah.
I mean, there's much more concern that they could get cancer. They don't really think as much about heart disease. So do you find that, like, you know, on a daily basis when you're talking to people? Because so many women, they just see you as the primary care, not just the GYN, you know?
People forget that and don't realize that it's a delayed 7 years, but women live 7 years longer than men. So it ends up being about equal percentages of death from heart disease for men and women. It just at different stages.
It just gets those guys earlier.
Yes.
Which is why we don't think about it as much. And, you know, is there some other differences, you know, than, you know, how men and women experience it too that may make women not think about it as much?
Yeah, it's very different symptoms. Men have the more dramatic, the big classic heart attack because they have big vascular disease versus small vascular disease in women, but it ends up doing very similar. Men have the Widowmaker heart attack, and women have heart failure from microscopic or much smaller vessel disease.
Smaller vessel disease.
Yes.
So it's not how much you love, how much you are loved, and it's not how big your heart is. It's are you getting it checked?
It's a whole bunch
that was like a mouthful of stuff, Betsy, but that's right.
It is a whole bunch of stuff, and people do lose track of what's important. And I think a little bit the medical community has lost track too. We focus on diseases instead of health far too much,
right.
and picking diseases to treat instead of treating people.
Right. And there's not enough about prevention. It's sort of just this cloud.
Not nearly.
It's like the iCloud, you know, it's just sort of out there.
Unfortunately, the government also forgets that too. They love to talk about prevention, but rarely do they put that in front of where it should be and where physicians should be able to focus on it. They force us to focus on disease, unfortunately, instead of prevention by the way that we're reimbursed.
Well, talking about prevention, let's talk about some of the steps that can help you reduce your risk of heart disease. But everybody's been focused on COVID this year, and so many of the things that help you reduce your risk of heart disease help you reduce your risk of other chronic illnesses, and also can lessen your risk of having severe sequelae from COVID.
People mostly forget that there's healthy and unhealthy. There's diseases and unhealthy, but if you focus more on what is healthy and trying to do what is healthy, you're going to reduce your risks of all things. You and I talked about inflammation. That is a big part of almost every disease that we have, and it's totally lost almost all the time in healthcare, that you have to treat that almost first before everything.
Well, and when you're talking about treating inflammation, a lot of people think, oh, is there that magic pill? What do I need to take to reduce my inflammation? But it's not a pill to take, and we got to get out of that mentality. There's so many things we do on a daily basis that reduce our inflammation because those same things.
Well, a lot of what we do is not that we should do things to reduce inflammation, is don't do things that cause inflammation.
Absolutely. Yeah, that's the better thing. Don't have it in the first place. And what are some of those things? You know, because people are going, well, I don't know if I'm inflamed. What could I be doing that would be causing inflammation?
I will quote another doctor. I won't.
It would be me?
No.
Okay, just saying.
The standard American diet, which has the acronym of SAD, it is the worst diet, you know, that of pretty much all the countries in the world, our diet is just far too much processed food. They take all the nutrition out of the food, and it's easily stored, and it's very tasty. And it should be eaten a lot, but not as your mainstay of your diet. We should try to incorporate foods as close to the earth as we can instead of things that are been processed to death.
Right.
So not
for our
sugar.
mainstay.
Not the wheat thins and the chips that I love so much.
Sugar's the devil, as
Right, but you know,
as Bobby
not
Boucher
at
would
Mardi
say.
Gras. No, we're just saying, you know, it's one of those things. It's when you have that as your diet 100% of the
Correct.
time. You know, everybody can partake in something. Occasionally, it's when they
It's
have
not everyone.
it
You
daily.
should partake in good things,
Yeah.
but unfortunately, the mainstay of most people's diet is processed foods. That is what we go to: bread, rice, pasta, even oatmeal, which is always it's so healthy. It's still a processed
There's
food.
a lot of sugar in those little packets of oatmeal.
Well,
Yeah.
they do hide a whole lot of
Yeah,
sugar
they
in
hide a
those.
whole
So if
lot
you
of
look
sugar.
if you read the labels, you'll find out.
Yeah.
So and other things like just so much more than just what you eat. But we've talked about that too. The exercise. Because lack of exercise causes it's a whole
That's
lifestyle.
why I don't like to even call
it's
diet,
your mindset,
or it's what you
whether
do and who
sleep
you
enough.
are.
It's just a whole thing. But you have a real special interest in heart disease and risk reduction. So tell us a little bit about that.
I do. You realized 8 years ago that I was at risk for heart disease after my dad had a heart attack, and I checked my cholesterol, and it wasn't terrible, but a doctor actually came and spoke at Women's Hospital about lipids, and it was an evolving field, lipidology, and they did an advanced lipid profile, and by the regular lipid profile, I was okay. I was just under 200. My LDLs weren't great, and my HDLs weren't great, but I would have never. But when you do the advanced one, I was 99th percentile. Are you going to die?
Right. Well, people get, when we first started in training, it was the one number, just your total. Then they came up with the 4 numbers: the good cholesterol, the bad cholesterol.
Right. And that's still what most of the industry pushes. But unfortunately, it misses about half the people. Like it would have missed me. It would have said I'm at slightly increased risk, not of you're gonna probably die at a young age of a heart attack.
And that's when you're looking at the advanced profile, which looks at particle sizes and how well do they function, and also, like I had lipoprotein A, which some people have never
Most
even heard of.
doctors don't check of. Never even heard of.
It's usually not even checked, and I would have never had mine checked had I not done a little screen to look at my vascular age. And when I was 15 years older than my vascular age was older than me.
Because your cholesterol was fabulous.
Because my cholesterol was fabulous. He was like, "You're going to live forever. You're not going to, have a heart attack." But there's so many factors. It's a lot more complicated than we thought than what we thought the answer was 20 years ago.
So why don't, when they do any type of screening for people who maybe have a family history, why wouldn't they go ahead and look at your lipid profile, or why wouldn't they test you for lipoprotein A, excusing the fact that it might be a more expensive test? It could save your life.
Yeah, it should be done once in almost anyone's medical testing at some point in your life, particularly if you have any heart disease in the family. The reason they don't is it's not reimbursed, and there's no treatment for it, but it's still good things.
You need to be aware, so you change your diet.
Yeah, you should realize that, I better be as healthy as I can. And again, unfortunately, we far too often focus on diseases instead of, again, health. And so that's not.
So if you love somebody, Valentine's Day is coming up, and we love a good party. We love a good party. Make reservations. And so,
it's good for your heart.
So maybe couples, married or not married, should plan a date to go to their cardiologist, or just have a let's go check out our heart kind of thing. Not just the love, but the physical. Like, come on, let's go to the doctor together.
Well, do something healthy together.
Yeah,
That's a nice
absolutely.
thing too.
Yeah. Yeah, do something healthy together. And it's just constantly evolving. I think that we're going to be able to talk lots more about that. We didn't even know inflammation was part of it until in recent years
Very
either.
recent,
But I think this is a hugely evolving field. And thank you so much for taking time away from watching my baby puppy to join
We don't get
us
to
on
see
the
Curtis
show
Mitchell at
tonight.
the show. He's out watching the new pup.
Yeah,
But we're really
yeah.
glad
I have to
that
have
you
the
came.
important jobs.
That's right. Very important job. What better person to watch the pup than a
That's
doctor?
true.
I mean, that's good care. But thank you for coming, and
I've
thank you for
enjoyed
taking
it.
such good care of my dear friend Kay. I love her. I know you do too.
I do too.
And I always enjoy learning from both of you. I always learn so much from you, and thank you so much for coming.
Thank you.
Yeah, thanks. He makes sure I eat well, I try to exercise, and that I'm not stressed at all.
Yeah.
So, but I'm going to tell you, we're going to be having the most fabulous king cake in the world coming up. You're going to want to know where to get yours, and some of them do have a little
And I
booze
will
in it.
have that
Just
too.
saying. Yeah. So stay tuned.